Hey, and welcome to Single Mom Honey, the podcast dedicated to single moms with a focus on health, money, and everything in between.
And I cover the health.
And I'm Aisha. I cover the money. So today we are going to be talking about something very real that impacts every single last one of us women, single moms, divorced moms, baby mama. I don't care what your title is. It doesn't matter to me.
You don't have to call me a baby mama.
You are a woman. Oh, we're going to have the distinguishment between mother of your child and baby mom.
Absolutely.
Wow, some things are just unacceptable.
Again, I'm Quaylin, and today we're talking about something very important. And that would be cervical and breast cancer screening guidelines. We want to make sure we stay on top of this. Because I don't know about you, I think one thing all of us single mamas have in common is a cervix in our bitties, or our titties, or our breast. What you call yours?
Titties.
Okay, I used to call them babas, especially when I was breastfeeding. Oh, you did?
You breastfeeding your first child, being in a restaurant with you, and she came up to you and pulled your boob out and said, "I want baba." And I said, well, this is before I had kids, so I was like, "Oh my goodness, I can't believe that just happened!" In front of the male waiter. He was like, "Oh, y'all want some more drink?" I remember that. It was a barbecue spot, and I was like, "Oh my gosh!" But she was able to walk and talk and say, "I want baba." I think she was about 3 then. I was like, "Wow."
Yeah, I breastfed her for a long time. I always like a straight cow. I had milk for ages.
Yeah.
And anyway, that's why it's so important to stay on top of your breast.
Yes, they've been working.
Yeah, they still working.
Yeah.
So breast cancer and cervical cancer can be very heavy and detrimental to your household, your health, and you being a single mother. So we want to make sure that we are doing the proper screenings and doing them on time.
Yeah.
Okay. I know at times topics such as breast cancer or cervical cancer can be overwhelming or intimidating, but this is something that we need to conquer. And we are single moms. We can take care of everything. First, we got to start by
take care of ourselves.
Exactly. I was going to say that. First, we got to take care of ourselves. I might add that your skin looks beautiful. The melanin is melanating over there.
Thank you.
Y'all
want to see? Go ahead and watch us on YouTube at Single Mom Honey Official.
All right. So we are going to try to break this down so that it's easy to understand and you can take better care of yourself. Okay?
Absolutely.
All right.
So the first is the updated cervical cancer screening guidelines. I remember after having my girl, it was such a blur. I'm not sure it was the first son or my second son, that they told me, okay, now that you had a baby, you don't need to go every year to get your pap smear. It said the new guidelines are every 2 to 3 years after having a kid. What? Still go every year because that's what I was known for and that's what my insurance pays for. But I'm sorry, I went off. I'm going to go right back to what the guidelines are. So let's jump right into the cervical cancer screening. So because guidelines have updated recently, if you have a cervix, that means you haven't had surgery removing your cervix. So here's what the new American Cancer Society guidelines.
All right. So the American Cancer Society now recommends that people with a cervix, all right, or people assigned female at birth, start regular screening at age 25 and continue until at least age 65. But I would recommend if you are sexually active before that, you get your cervix checked.
I was about to say, what about the people who've been having sex since they were teens?
Then they need to get checked.
Absolutely.
And sometimes you need to get checked before that, even if you're not having sex, especially if you have abnormal bleeding or something's wrong. You need to get checked. Listen to your body is the most important thing.
Yeah.
Because sometimes things are off.
Guidelines are not rules or laws. They're guidelines.
Guidelines.
They can be adjusted and changed based on everybody's personal situation.
Right. So the main purpose of getting cervical screening is to catch precancerous cell growth early. So if something's going wrong, we want to catch it early so it doesn't progress. And cervical cancer can progress quite quickly. And, we don't want that to happen because then you have to face other consequences. And if you don't catch it in time, it could go everywhere in your body, right? So if we are able to catch any cellular changes quickly and early, we can basically create a treatment plan that we would be able to get rid of those changes or, help you modify your behavior and make sure you keep your cervix healthy. healthy and happy, I should say.
Yeah. So there are 4 ways to screen, and this is new information to me. Clay is the one that covers the health, but the preferred one now is the primary HPV test, and that's human papillo how do you pronounce it?
Papilloma.
Okay, human papilloma, okay, virus.
Real fast, all together.
Yeah, human papillomavirus tests or HPV tests every 5 years. Now that test looks for the virus that causes almost all cervical cancers.
Okay, so one of the big things about HPV, there are definitely vaccines now, right? So you can get that HPV vaccination. It used to be prior to age 26.
Mhm.
I think they would start like a pause. We're going to pause real quick
Okay.
because I want to make sure I have that correct.
Have you ever heard of the self-collected HPV test?
Yeah, but the thing is, if you don't actually get the collection right and you don't get the right cells, I don't see how it would be effective. So let's talk about the HPV vaccination. I got that myself right when I turned 26. Back in the day, I want to say I had my first baby when I was 25, and I was definitely a single mom.
I didn't know you were that young, girl. I don't know why I thought you were
Yes.
30.
No, definitely wasn't 30.
Oh my gosh, you
I was
were a
25.
baby. Can you imagine?
I was a baby, having a baby. Like, you don't even think 25 is that young until you're like almost 45. You're like, oh my God,
What the
what
hell
was
did
I
you
doing?
do?
But back in 2007, guidelines for the HPV vaccination were up until age 26. So I got it right at the end, the very end. Like I had just turned 26 and finished my shots. Otherwise I would have had to wait. But luckily, guidelines have changed. So routinely, it's recommended for children ages 11 and 12, but it can start at age 9. And this is to prevent HPV related cancers. So most of the studies back in the day focused just on women, and they would get HPV, and that could lead to cervical cancer and things like that. But more recently, people started thinking like, well, where does the HPV come from? Typically, it
Hello.
comes from a dick,
Yeah,
right?
usually most things that are destructive,
So now, there is a push to vaccinate boys and girls. And then
which makes
some,
all the sense.
yeah, yeah, yeah. And then you think about like boys who, or men who have sex with men, right? There are a lot of throat cancers that are related to HPV. So that
Girl,
means
you just blew my what?
So, that's why it's very, very, very important. When you vaccinate your children, you are giving them just a shot for their future. Because I just want to say these vaccinations are actually highly effective. And I know that from personal experience. When I was having my second child and I was married, whole ass married, my pap came back with HPV, right? Now it has since cleared. I don't have it anymore.
Mhm.
But that was from the person who I was married to, but luckily I had the vaccination. So I didn't have I was protected against the strains of the HPV virus that could have caused cancer
Yeah.
or other types of, oh my God. I mean, HPV can give you a run for your money, but again, it's just the education that will help. So I definitely recommend the vaccination itself. The CDC recommends a 2-dose series for those starting before age 15 and a 3-dose series for people ages 15 to 26. Now, you can get it past age 26. So you just want to engage in some shared decision making with your PCP or your gynecologist or whoever is going to give you those vaccinations. But if you have young kids, get them started early so you can protect them early. If you have
So
teenagers, go ahead.
why would you choose between 11, 12, or as early as 9? Like, what are the benefits
What are
of
the
going young?
benefits? Because, I mean, it's sad to say, but like we have a highly sexualized society,
Mm,
right? So a lot of times I feel like our children they're taught about sexual orientation in school, but without sex ed, right? And they have access to a lot more than we did back in the day,
with the
right?
internet, the inner of the nets.
Yes.
Yeah,
Yeah, and they
you
get
find
caught
out
up.
about things.
Exactly. They find out things before we want them to. But, the best thing we can do for them is to have them equipped with the vaccinations and the knowledge
Mhm.
so they can, prevent things from like this happening. You also have to know that like HPV, although, it's transferred with sex, it can be from skin to skin contact. So You don't even have to go all the way to get it, you know? Yeah. First base, second base, third base. You know what? Honestly, I don't even know the breakdown anymore. Do you?
Girl, no, I don't know.
And it could have changed. Just the same way that slang changes over the years.
Remember people were talking about hooking up? It could mean anything. It was so variable. Like
Exactly.
hooking up having sex or hooking up doing oral sex or is hooking up doing fingering or is hooking up doing hand jobs or is hooking up
Right.
kissing and groping. Like it was so I never got onto that. I never figured it out. I never used the freaking term hooking up. Like we hooked up. Like what?
Yeah, and like say you're a person who started your HPV vaccination, right? You want to make sure that if you didn't get all your shots, you get your catch-up doses.
Yeah.
So, whatever that's going to mean for you, just follow up with your PCP or your gynecologist or whoever is going to give you those injections.
So who
And it
gives the children the HPV vaccinations? Is that their pediatrician or do you
yes,
have to take them to a okay.
yep, PCP, pediatrician, that could be your nurse practitioner that they see or their physician assistant or their MD or DO.
That's interesting. So my kid's pediatrician will give them an HPV vaccination, but they won't give them the coronavirus. I mean, what is it called?
You mean the vaccination for COVID?
Yeah, they won't give them COVID vaccinations, but they'll give them HPV vaccinations. They told me I had to take them to either a clinic or take them to like CVS or a grocery
Well,
store.
you know what? Sometimes it depends on what the different clinics have access to. And some offices don't have like that standing supply of the vaccinations.
Okay, me and my pediatrician, I requested it when they lowered the age for kids. I
Mhm.
requested it for my children and said we don't have the vaccination here for COVID.
Yeah, so sometimes they have them like it might be at your local Department of Health, or they
Okay.
may only have them at like a CVS or like, a drugstore. It all depends where the funding is and who has the places to store them because all those vaccinations have to be stored in at different and specific temperatures. Like,
Mhm.
so if they don't have the ability to, you don't want them giving them some hot COVID vaccinations. Okay?
Right.
Okay. All right. So again, if you have missed out on your HPV vaccinations or you're over like 26, you can still get them. And I would recommend it, especially if you're sexually active. I mean,
Absolutely. We're trying to
no
protect
need.
ourselves and prolong our lives as long as possible because we are the only dependent person that most of our children have.
Dependable person, I will say. Yeah, there are
Yes,
dependents.
dependable. Yep, that's the word.
Yeah, so definitely would recommend. And I was just very thankful that I got it. I was like, unfortunately, like I always say, you're always monogamous until you're not. And a lot of people are just asymptomatic when it comes to HPV anyway. So
Yeah.
your partner doesn't know that they have it, or your partner may not have caught everything else from that other person they're sleeping with. But, HPV, like I said, can come from skin to skin contact. So even if they're like, I ain't even really sleep with them, like, or I didn't cheat, everybody has degrees of cheating, So, yeah. Anyway, some of it will clear up on its own, and other things you will need treatment for.
Mhm.
Fortunately, I got that vaccination because I'll tell you, marriage does not create a safe place or make you not vulnerable for STIs or any of those things. I just want to be clear here. Like
Yeah,
you
that's one of
could
the
be on
main
your high
reasons.
horse if you like, but the realness of it is like you can only trust yourself and you are responsible for your health.
Yeah, so protect you because that's one the number one reasons for divorce is infidelity. It is what it is.
Divorce, breakups, and then there's money.
Yeah.
Health and money.
Hello, honey.
Yeah.
Good information. So
Okay.
there are 4 ways to screen, but the preferred now is the primary HPV test, which is every 5 years, and HPV stands for human papilloma virus.
Papilloma.
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 Okay, human papilloma virus test, which happens every 5 years. That test looks for the virus that causes almost all cervical cancers.
All right. So this is a big shift. Now we all going for our pap smears, right? The pap, the forbidden pap. Now I want us to be real here. If you can take the dick, you can get your pap done.
First of
Okay.
all, don't judge, okay? That pap smear thing, that speculum, it looks like something out of medieval times. It is 2026. They can't come up with something more comfortable. Like, you can't come up with no dick shape. You know what I'm saying? Like, insert like a dildo and open it up from that way or something like that. Why I gotta be all like an ice cream scooper? Like, I
Well,
just don't.
first of all, you got to be able to see. Now, from someone like me who's done quite a few pap smears and screenings for cervical cancer, I should say there are the metal ones. There are also ones that are made out of plastic that have lights on them, and there are different sizes. So it also depends on the positioning of your cervix
I have a
and
tilted
everything.
cervix.
Right. So right, depends on so they got to dive in. Okay.
Are you okay?
So yes, it can be uncomfortable, but your health will be way more uncomfortable if you skip your pap
Free?
smears. Okay, fine. So you can always ask your provider, like, "Hey, this is really uncomfortable. Could I use a smaller speculum?" Or, we do use lube. I mean, but again, we have to be very specific about when we're doing the testing to get the proper cells, so we can make sure that there have not been any changes on the cellular level with your cervix. So, again, so when it comes to testing, you're going to be in a private space. It's going to be you, your provider, and most likely a medical assistant. You can also have someone in the room with you if you feel uncomfortable. I know I don't ever go in just by myself one on one with a patient because there are some patients we realize have trauma, that can interfere with them getting testing regularly. It could be sexual trauma, it could be, you know, all types of things. You just never know. So feel free to ask your provider to meet your needs or if you need accommodations when you go in, but just don't skip it. So you'll be at a clinic or sometimes you can do the testing at home. You can do your own testing like with this swab, but you got to make sure, again, like I said, even when I can visualize the cervix and still miss cells, like I think doing home testing might prove to be a little difficult, but that is an option as well. And if you can do home testing, maybe that is an option for you if you're like, oh my God, I hate the speculum. I hate putting my legs up in those stirrups.
Yes.
I hate when
Can
they
you
be like,
scoot down a little bit more?
scoot,
Can you,
scoot.
girl, you got my booty meat hanging. I can feel the breeze.
Right. And then it's just like you scoot down. The only time I be scooting down like that is when
Violated.
you get swallowed.
Violate.
Yeah. So it's a it's a different feeling where you're like, man, you guys are besties at that point because face was all in there. Like, yeah, I can understand how it can be uncomfortable because it's uncomfortable for me because all vaginas are not made equally, and they it's not my favorite part of the job, but got to be done. Okay, so again, if you feel uncomfortable can opt for a home kit, but make sure you're following the guidelines and getting tested as often as recommended. If you have abnormal results, you might have to come in more frequently, but go back because what you don't want to do is miss out on the opportunity to get treatment that you need
Yeah, if
or
necessary.
miss changes that, you could have caught early.
Yeah. I agree. So here's a quick breakdown. So the primary HPV test, as I mentioned before, is every 5 years. That is preferred. Now, self-collected HPV test is every 3 years, which Quay said could be a benefit for those who may have trauma when it comes to the speculum.
And it's
Or
only every 3 years if it's negative, if you get negative results.
yes, yes.
Okay.
Or the co-test. So this is the HPV and the PAP every 5 years.
Hmm.
Pap test alone is every 3 years. So that's what I was talking about before after I'm not sure which son it was, tell you the truth, but they told me I didn't have to come get a pap smear because they already been up in my shit from having this baby for 9 months. They was all up in there and stuff like that. And they said, "Now you don't have to come back until every 3 years. The guidelines have changed." I still go every single year. If that's what my insurance is covering, I don't see anything wrong with making sure that it's covered and I feel secure in it. Not sure why they're trying to spread it apart.
Well, I think it's kind of like risk mitigation, in the sense where, like, hey, they will assess your risk and see what's going on. And if it's negative, some people's insurance won't cover it every single year.
That's the standard, is that a pap test is covered every year. It's just the cancer guidelines. I mean, the medical guidelines change to every 3 years or as needed or whatever. But the insurance, every female exam is covered 100% every single year, every calendar year.
Well, you
Right.
do work for an insurance
Yeah.
company.
That's why I was like, why would they try to push it out if the insurance is paying for it? Fuck yeah, I'm still coming.
Well, a lot of people don't know that because
Mm,
I still think we would get pushback, like as providers, if like the guidelines change, the insurance can fight paying it. You probably can still
mm.
get it, but they'll bill the patient. You get what I'm saying? Like, oh, hey, we're not going to cover that, or for this reason. Like the same way if you go in and you're just getting a regular PAP, right? And if you have a yeast infection or something like that, it goes from being covered as a preventative measure to a problem visit. And then, yeah, like It's and there's all these little guidelines, but you see it more often. I work on the patient facing side where
Mhm.
you got all the policies.
Girl, I never thought about we are opposite sides.
Yeah.
I work in insurance, you work in the health field.
So I be fighting y'all.
That is well, I don't do approve, so I'm gonna make that very clear. I do not approve or deny, okay, insurance claims. I do the behind the scenes work. I don't do that.
I
So,
get it. I ain't blaming you. I'm just telling you, you gotta call back in like, sir, ma'am, we need this. That's why I prescribed it, or that's why I wrote this order for this. Well, I mean, they could get it, but they ain't covered yet. Like, even when you think about mammograms, right? You can get them every year or how they're scheduled, but you don't want to come a day before, 10 days before
yeah.
that annual date, because then you're paying something else out of pocket, and we
And
have to
God
think about
forbid
that.
you go before your 40th birthday, you're gonna have to pay for it, which is crazy because women get breast cancer earlier than the age of 40. That needs to be lowered
Absolutely.
down. Like, why does it matter?
Money, 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 money.
Yeah,
Unfortunately, money. Okay, so the main thing to remember is that getting screened regularly is what really matters. Stay consistent, be consistent with yourself.
yeah.
Make sure you follow up when you're supposed to. No one else, don't be saying, oh, you know what? I called them, they ain't call me back. You call. It's your responsibility.
It's your health,
Yeah. Well, they didn't call me back and I tried to schedule all this
okay?
time. What does that mean? It's on you. You got to advocate for you.
Right?
Regardless of what tests that you end up using, whether you do a self exam, an approved self exam, or you go into the clinic, make sure you follow up on those results. Don't just get a test and don't know if you passed. You
Yeah.
know, and if they say something's wrong, don't. A lot of people act out of fear and they don't follow up.
If I
That's
don't pay
only
attention to it, then it didn't happen.
if they don't. If I don't look at it, it ain't looking at me. That's not how it works. Yeah.
Yeah.
And you know what? Even if you had the HPV vaccination or you haven't been sexually active in years, you still want to make sure you get all your screening. Because what if it's something that you just didn't catch? Like, you missed because you haven't been screening. And a lot of times that's what happens to people, especially single moms. We get so busy, so busy, so busy. We put ourselves on a back burner and we forget to take care of ourselves. The tools and the resources are out here, so utilize them.
And I wanted to point out that your health as a mom
Mhm.
does not start and stop at just reproduction. Like,
Exactly.
that's the only time people wanna think about what's going on down there is whether or not you got a bun in the oven or you're trying to make sure that child is
You
healthy.
are a whole person.
What about
All of
you?
you. Yes,
You
all
know?
of you.
We have utilized these wombs, but we also need to take care of everything else around there, like
Exactly.
we're more than just baby machines. Think about that as well. And also
Exactly.
sex machines. Like you're not sexually active, so you're not gonna go check on yourself. So it's still your body is still moving, it's still changing. Just because you're sexually active or
Exactly.
not does not mean not to take care of yourself.
And then remember, if you are sexually active or engaging in any behavior that puts you at risk for all the things, i.e., having sex, being an adult, make sure you are getting checked out because cervical changes don't always happen slow. There are some more aggressive forms of cervical cancer. You want to make sure that you are just staying on top of your health. Get screened if you have abnormal bleeding, if you have abnormal pain, if you have things going on, like, you know what you feel. No one else can tell you what you're feeling. Go
Yeah.
in there, you advocate until you get an answer.
Yeah. All right, so let's move on to the other portion of the show, which is breast health or titty health, as I would like to
Bye-bye.
put it.
Bye-bye health.
Baba health. Self-awareness versus mammograms. So, talking about them tatas, them tiggle bitties. There's a lot of confusion here, as well as with the cervical health, especially when you hear things like do a monthly breast exam. Do you do that, Quay? Do you do a monthly breast exam?
I feel these girls every day. I be like, my nipples feel weird today, or they're a little bit more tender, or like, I mean, I check, not every day, not every month. Should I do that? I mean, you can, but that's not the end all be all when it comes to checking for signs and symptoms of breast cancer.
Hmm.
Most times people can't feel if they have like nodules, when they first come about. By the
Hmm.
time you feel them, you may have already had a lot of growth,
Maybe we could do that. We could put up a video of you showing how to do the breast exam. Even if it's not just
Absolutely.
your boobies, you could use
Yeah.
it on, like, a mannequin or something like that, but
Okay.
to show how
Absolutely.
to do it. 'Cause they give you that damn
Absolutely.
pamphlet. I ain't reading that. Why? 'Cause I ain't But,
I would definitely
official
do that.
guidelines have changed also when it comes to, breast examinations as well.
Yes. So the American Cancer Society doesn't recommend the formal breastises. Okay, breast self exams or routine clinical breast exams as a scheduling or screening tool for breast cancer. I mean, because again, like I said, even if your provider comes to do, your breast exam and they start going all around and you know they're still liable to miss something. Like, we don't have x-ray vision, we can't feel everything, and there's always that human factor. So more importantly, doing these self breast exams and your provider doing them didn't show research shows that it didn't help anybody find breast cancer any
Mm,
sooner. So, you really want to make sure that, especially if you have like a family history of breast cancer, you mention that to your provider. Because sometimes, these guidelines get moved back and forth. It's like, hey, start at 40. Oh, now you don't need one to 45. But as we know, people get breast cancer earlier and earlier.
teen, 30s, like
Yes. So,
40.
make sure if there's breast cancer anywhere in your family, you speak on that and say,
Yeah,
"Hey, yeah, there's a history." Because then from what I've seen, the insurance will cover the breast cancer screening earlier
okay.
than the recommended guidelines. Like, I know when I went in to get my first exam out, I wanna say I was just turning 40, but they may have moved the guidelines at that time to, like, 45 or something like that. And I was like, "Oh, no." My grandmother had breast cancer, so I need to be tested, right? And I'm sure somebody somewhere in your family, and we all know that breast cancer can skip from generations. It can go, I mean, it's unpredictable. Sometimes people don't even have a family history. So, get checked out as soon as you can.
Absolutely, because you just should know your own body, like, that's
Mhm.
very important. So, experts talk about breast self-awareness, which means paying attention to changes in how your breasts look or feel. Like, Boy said she fill herself up every day. Not every day, every day. Okay? And not following a strict checklist with your calendar. Like, some days just feel off. Like, I could tell when my period's about to come on because they start getting a little bit tender. I could
Right.
tell when I was pregnant because they felt weird as hell, and I was like, "Wait, what's going
Right,
on?"
right, right.
The test
That's
because
how you
I
know.
know my body it's been with me my whole life, okay?
Mhm.
I can tell when things are off or changing, and not like I said, not following that strict checklist, but so that something unusual shows up, like a new little lump,
Mhm.
your skin is look like you got a
What's in
dimple in it,
discharge? Why you
you
got
know,
discharge or
nipple
something else crazy?
discharge, I've experienced that nipple discharge after breastfeeding, years after breastfeeding, discharge is coming out of my breast, so I had to get that looked at. Nipple changes, your nipples are flat now, they used to be more rounded, you know?
Right,
Persistent pain, like, "Why are my titties hurting? What is
right.
going on?" You check with your provider right away.
And
Get
especially if
adequate
it's not, like, on both sides or, like, you just have it you're like, "Hey, it's just my right breast," and, like, I also, when I'm checking, if I feel something weird, because I mean, I will say I don't do the breast exams quite as frequent as I used to back in the day, or maybe not in the same intensity, but if I would feel something weird, especially when I was breastfeeding, like, because sometimes you'd be like, "Oh, man, I need this milk to come down,"
yeah,
I would check on the other side to make sure that I was feeling the same, you
sometimes
know
that'd be blocked milk ducts.
yeah, 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 I know, I
It
know.
should be safe to start.
Exactly, exactly. So, when it comes to mammograms, according to the American Cancer Society, we're gonna follow the following recommendations. People age 40 to 44, you can choose to start your annual mammograms then. If you've had, like I said before, family history, you can get a mammogram earlier. So, if you know your mom, your sister, your aunties, everybody had breast cancer, you might wanna go and get checked out early so that you don't get caught up.
Yeah, it runs in my maternal side. I have 2 aunts that have had breast cancer.
Right.
So they put me at a higher risk that I need to come get checked every year. It's not
Exactly. And it also depends on the density of your breast tissue. Because
Mhm.
sometimes if you have like super dense breast tissue, it's hard for them to detect whether something is going on the cellular level. So you might need to come back more often than other people. I know for me, I have dense breast tissue. I come back every year, because they're like, what's that? I don't know. Let's see. Let's make sure we check it next year because we don't want to wait a whole nother year,
Mhm.
and where you could have had treatment or something, right? So age 45 to 54, you would start having yearly mammograms anyway. And then age 55 and older, every 1 to 2 years, depending on your health and your doctor's recommendations. Okay. And then if you ever have discharge, pain, discomfort, you can also go get a mammogram or an ultrasound to make sure that everything is okay or to see if something's going on. Okay.
Yeah. These screenings help find cancer early, which is always a plus, and often before you feel anything as well, because
Exactly.
it will be a shock, but at least you could have a starting point to figure out what's the next steps to be handled in order to make sure that you stay as healthy as possible. And that's why they save lives. That's why it is necessary. I know women who are over 40 who has still haven't gotten a mammogram. That's for old ladies. I ain't 60 years old. What I need to go get my breast?
Exactly. And then I've also heard the ladies who are like, "Oh, it hurts so bad." Girl, bye. Like,
Yes, I've heard that too. My
now
goodness,
I've
I've
had
heard that. They smash your titty like that.
no, it's not like that. That is like an urban legend.
Titty, I heard. I've been
No.
told it hurts. I don't know, Quay. I think it may just be if you're a breastfed mama, then maybe you don't feel it.
Yeah, if you ain't had them nipples bit,
And pulled and the kid
yeah,
turned their head like, "Ah," and got your
right.
nipples in their mouth in their teeth
I
or something like that.
I remember breastfeeding my middle daughter, and she might have been almost 2 because I was pregnant with Carter.
Mhm.
And Carter's my son. And they're like 2 years apart. And she had an apple in her mouth. And I didn't know. And then she came to get some milk. It was like she took a bite of an apple and was like, I need to rinse this down with
Need
some
some
hot milk.
juice.
Yeah, right. And she came to me, start feeding, and I'm chilling, chilling, chilling. But now, if you've ever breastfed or breastfed while pregnant, like your nipples are already tender just from the breastfeeding, and then they're extra tender when they're pregnant. This little girl decided in the middle of breastfeeding that she wanted another bite of the apple. I didn't know she had apple in her jaw over there. And not only did she bite the apple, she bit my nipple. I cried like a baby, but after that, I realized I'm a thug. So if I got to get a mammogram, anything I got to get, like, I'm going to go get it. Cause
And
like
you'll feel
that
nothing.
was the worst pain I ever felt. Somebody biting off your nipples. She drew blood. Little baby vampire.
Listen, I have a story.
Mm-hmm.
When I had my youngest, I was breastfeeding him. Now my boys are 3 years apart, so I got a 3-year-old and a newborn. I'm
Uh-huh.
breastfeeding the younger son, and I was half asleep. It was one of those like, just he wanted to drink. I've been up all night long. I
Yes.
woke up to the most excruciating pain I've ever felt in my life. I woke up disoriented. I didn't know what was going on. I was like, why? What's going on? I looked down at my son. He's still latched. And he's still breastfeeding. While my 3-year-old was on my nipple biting it because he thought it was funny. He was trying to breastfeed like the baby. He was like, ha ha ha, ha, girl. I almost decked him out and dropped the newborn at the same time. But when I tell you the pain, I was like, why would you do that? Why would my nipple like doo 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 doo. He thought it was funny. He like ha, mommy. Ha. That's what he thought his brother was doing. He thought he was biting the nipple.
Listen.
I totally blocked that out until you told this story about the apple. Yeah,
Yeah. Yeah. Yeah.
kids.
But again,
Them titties have been through some things. Take care
exactly.
of them now. Take
Let's
care
get your
of them.
mammogram.
Titties have been through some shit.
Absolutely.
So mammograms are especially important because many breast cancers don't cause symptoms until later stages. And you
Exactly.
earlier stage, you're the earlier stage, the better.
And I would also say, like, if you are having trouble scheduling a breast exam or you go to get a mammogram and someone, when you get there, gives you a hard time. I recently had a friend who was about 40. She went to go get her first mammogram.
Hmm.
Now, she looks fairly young. She got there, and the lady at the window was like, "Hey, why are you here? Like, you don't look old enough for a mammogram."
How
First of all, that's
unprofessional.
no one exactly, but you're gonna run into those people. So, I guess I'm saying this to say, when she went to that lady, she wasn't able to get her mammogram that day. She had to reschedule it or something of the sort, but she actually had breast cancer, and this was her first mammogram. And had she not had the wherewithal to be like, "I'm still going to go get checked out. I'm still like, screw you." There are people who don't regularly go to the doctor, and something like that would
Deter
deter
them.
them.
Yeah.
Yes, yes. And I'm just so thankful. Like, she had breast cancer in both breasts, and
Wow.
right, 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 right. So again, don't skip these. Do not skip these screenings. Like, I'm thankful that she survived breast cancer. She's a breast cancer survivor. She had a double mastectomy. Like, she's doing great. But had she not went and got tested, despite the person telling her she didn't need it, she's only 40. She could have waited to the next year, and I don't know what her outcome would have been.
I hope
So
she reported that lady, bitch.
she did. She absolutely did. All right. So now let me try this again. Let's talk about how to schedule around your busy life. You really need to make sure you get these screenings on the schedule, and it's a non-negotiable. So we hear this all the time from our bees, our honeybees. At tea time, I'm stretched too thin to go to the doctor and stuff. Or I have to get my kids to all their appointments. If you don't take care of you first, who's going to take care of your kids?
Exactly.
Right?
Come on now.
So it's very important that if you have a mammogram scheduled, put it on your calendar. There is no excuse to be like, oh man, I skipped. Sometimes it takes a few months to get in. It really depends on the availability because, like I said, people are getting mammograms yearly. Everybody's on different schedules. And, when it's your turn, you want to get in when you can. Make sure that you give it the same respect as you give those parent teacher meetings or those meetings with your boss because you come first. So get the mammogram. You want to also ask, like, if you are going in for maybe your PAP, right? You can schedule all of these things all together so that you can knock it out in one day. Because I know sometimes as single moms, we can't afford to take off work or, not on multiple days.
Sacrifice another lunch break to go run to the doctor, or to
Exactly.
be there longer than you're supposed to be, and then
Exactly.
make excuses when you get back to work. So, yeah.
Yep. And then you can often opt for later appointments. Sometimes there are different facilities with later appointments or like on weekends. There are screenings available. Yeah, but you really have to search for those. So, utilize your My
Network.
Chart. Yeah, your network, your My Chart. You also want to make sure you put in reminders. I use Siri all the time. Be like, "Hey Siri," I don't want
She's
her to
listening
answer me
right
right
now. She's like, "What?
now. I know.
No, girl." Okay.
Put a reminder in your phone because I know as a single mom, I call it mom brain. And you have all these things on the table and you add one more thing, something falls off, right? And then by the time you remember, you already missed the appointment. Okay. So make sure you put more than one reminder. Put it in your Google Calendar, put it in your Siri, put it in your Alexa, wherever you got to go. Remind yourself to take care of yourself.
And I will also add, when you do make these doctor's appointments for yourself,
Mm-hmm.
put it in your work calendar as well so people don't schedule meetings around that time that you're going to be gone. So include time to travel to your appointment, be at your
Mm-hmm.
appointment, and travel back. Put it as soon as you make that appointment, put in your work calendar as well. So this is the time. Do not be calling me. And you don't have to put it in, make it private. It doesn't have to be known what the
Exactly.
meeting is for, but block off that time for yourself.
I agree. And don't make excuses. If like cost associated with transportation, um, or you have scheduling barriers, remember there are mobile clinics. There are assistant programs that you can get some treatments covered, and a lot of preventative measures are already covered by your insurance.
Yes.
So make sure that you
You're
take
paying
advantage of
for it.
these things.
Use it.
Exactly.
Use it or lose it.
Yeah, don't lose you in the process.
Exactly. You
Okay.
can't afford losing you.
Exactly. Call your local health department or clinic and ask what they got available. Your health matters.
Absolutely. So taking care of your body is not something you do when life is perfect. Because if it was perfect, we would be thinking about nothing else.
Exactly.
It's something you do to stay strong for yourself and your children, even when life is busy and messy. You have to be a priority. We know you're a great mom. You're listening to Single Mom Honey, okay? We know
Exactly.
you're trying to figure out new ways and tips to make your life as better as possible, and also trying to pick up tips from other single moms like yourself or be able to provide
Exactly.
them. But look, life is busy, it's messy, but most importantly, we want you to be healthy and happy.
Exactly. And remember, like she just said, you're already doing a great job.
Mhm.
You're amazing. You're running circles around all the rest of the people if you're a single mom already. But you want to make sure that you get these screenings done. It's very empowering and refreshing and it just takes a lot of stress off your plate
Mhm.
to engage
What
yourself.
if? Yeah.
You ain't got to worry about it because you already know.
Yeah.
You don't need one more thing.
No. Who needs one more thing?
Exactly, because you already got 10 more things. Prioritizing your future and your health, that is that shows like strength, courage, and it makes you powerful.
Exactly. All right. So thank you for listening to another episode of Single Mom Honey. If you found this episode helpful, please leave us a review. We love fives. And between two of us, we got 5 kids. So each star for each kid. Subscribe to all of our socials. Also subscribe to our YouTube channel where you can actually watch this episode right now, and then share this episode with another mom who might need to hear it.
Absolutely. And we will see you next week. Same time, same place, everywhere you can find podcasts. It's Quay. I cover the health.
And I'm Aisha. I cover the money.
You bring the tea.
And we got the honey.
See you next time.
Bye.